Welcome to the Institute for Reproductive Medicine and Science at St. Barnabas. My name is Pat Rasinski, and I am the Clinical Nurse Manager for all IRMS offices. The video that you are about to view contains information that will help you as you proceed through your IRMS experience. Please remember that viewing it more than once or along with your partner at different stages of your treatment may prove valuable. We created this online orientation to provide our patients with the opportunity to learn about what to expect before, during, and once a medication cycle is completed. Most of the information we will review in this video you will also find in written form within your patient packet. You will also be able to access much of this information on our website, www.sbivf.com. Let's begin by reviewing the IRMS contact list which you have in your patient packet. The nurse or IVF coordinator that met with you at your initial visit will have highlighted your doctor's team. We believe that a team approach can make navigating through your fertility treatment a bit more helpful. Each physician at IRMS has key people on their team to work with you throughout your treatment. Each person on the team can assist you at any time. Please note that should any member of your team be out of the office for any reason, an alternate staff member will be assigned to assist you. By this time, you have had contact with our administrative coordinators. They assist patients with scheduling any office appointments or procedures done by our physicians, including any surgical procedures. They are also responsible for authorizing many of your diagnostic procedures. In our Livingston office, our IVF coordinators keep track of all of your prerequisite testing and checklist results. Anytime you need to know if a test result has been received and/or reviewed by your doctor, you should call your IVF coordinator. Your IVF coordinator will confirm with you that your checklist is completed and/or updated prior to starting any treatment cycle. Once your checklist is complete, your care will be transferred to the nurse on your physician's team. In the satellite offices, the nurse will handle both the checklist function and be your primary contact from your first visit. The financial coordinator is responsible for verifying your insurance benefits and reviewing this information with you. They are also responsible for obtaining prior authorization for your treatment before you can begin a cycle. You must be financially cleared by your financial coordinator before you can proceed with treatment. Your nurse, however, will be responsible for ordering and authorizing your medications. Your nurse is responsible to coordinate all aspects of your treatment cycle. She will discuss the timing of your cycle, review your medication protocol, order all necessary medications, and provide you with instructions throughout your treatment. For questions and information, your nurse is available through her phone number listed on the contact sheet as well as her email address. In addition to the nurse on your team, IRMS has a nurse on call for time-sensitive and emergency issues when the offices are closed. The nurse on call may be reached by calling the main number, 973-322-8286, after normal business hours. You will be asked to leave a message with our after-hours service, and the nurse on call will call you back. Familiarizing yourself with the people on your team is a great way to help ease anxiety you may have about your treatment. Also, becoming familiar with the office hours and monitoring hours at each of our locations at the outset of your treatment will help you to best manage your personal schedule. Another great source of information is our website, which includes an online message board. If you are seeking an online community, the message board may be a good place to see postings and comments from our physicians. Our own IRMS physicians cover the message board 7 days a week and will respond to anonymous postings. Please note, however, that once you are a patient at IRMS, you can speak to your physician directly at any time. The message board is not intended to replace contact with your physician. Now that you have a better understanding of our practice team approach and some of the important information, I would like to proceed to reviewing what to expect before a medication cycle begins. Prior to starting your cycle, there will be necessary prerequisite testing required for both patient and partner. We refer to this as your checklist. Some examples of the testing include, but are not limited to, blood work for both patients and partners, physical exams for patients, including vaginal cultures and pap smears, hysterosalpingograms, and semen analysis for male partners. Male patients also have a checklist that must be completed prior to treatment. There is a portion of this testing that we refer to as andrology testing and may include semen analysis and antisperm antibody testing. Hours for andrology appointments are also on our contact list. All prerequisite testing must be completed and results reviewed by your primary doctor prior to beginning any medication cycle. For Livingston patients, your IVF coordinator is your primary contact during this phase of the cycle. At all other IRMS locations, your nurse will guide you through the checklist process. Again, you must be advised that your checklist is complete and/or updated prior to the start of the cycle. Next, you will be instructed to contact your nurse to help coordinate your cycle. The nurse will review your medication protocol. Each physician will create a medication cycle plan based on a patient's age, history, and diagnosis. The nurse will then review this plan with you and provide you with a medication flow sheet. Our nurse, Wanda, will be reviewing the basics of the flow sheet later in this video. Once a flow sheet is given to you, the nurse will also review the medication ordering process. Infertility medications will sometimes need to be ordered through a pharmacy within your insurance plan or with a retail mail-order fertility specialty pharmacy. Your nurse will help guide you through this ordering process. All orders are sent to the pharmacy from our office. The pharmacy will then contact you as the patient to discuss your coverage, expected payment, and arrange delivery. As a special note for our IVF patients, your nurse will also need to review the timing of your cycle based on your medication protocol. Your individual protocol will determine the timing of your cycle. It is important for you to know that our embryology laboratory closes periodically throughout the year. This is taken into consideration when you work with your nurse in planning for your medicated cycle.
Welcome to your online orientation class. My name is Wanda Hofgesang, and I'm a registered nurse with the Institute for Reproductive Medicine and Science in the Livingston office. The online class has been designed to provide you with an overview of what to expect during your medication cycle. A brief reminder before we begin. You will need to make sure you have completed all prerequisite testing, which we refer to as your checklist, before you can begin. We also need you to have signed all appropriate cycle consents. Each cycle you do will need its own set of consents. The signatures on your consents must either be notarized, or you can return to the office and have the office nurse witness your signatures. It's also important that you follow up with your financial coordinator and make sure that you are financially cleared for your cycle. Some cycles require prior authorizations for procedures before you can begin. Each patient's physician will devise a medication protocol and treatment plan based on your age, diagnosis, and gynecological history. Your nurse will then review the medication ordering process. All medications will be ordered by your nurse via an insurance specialty pharmacy or a retail infertility pharmacy. Once an order has been placed on your behalf, the pharmacy will call you within 48 hours to review payment and shipment dates and where they are shipping it. If you do not hear from the pharmacy within 48 hours, please notify your nurse. Lastly, your nurse will provide you with a cycle calendar or a medication flow sheet. There will be some information already filled in, while other parts can be filled in by you as your cycle progresses. The flow sheet is a helpful guide, but please keep in mind your nurse will contact you during your cycle to review at all times what medications to take, the dosage, and when to take them. In addition to the class, you also can go on our website. Our web address is www.sbivf.com. This is our homepage, and you'll notice that we have an icon here that is for education. When you click on the medication information and video icon, it'll bring you to a screen here. On this screen, there's another little icon that will say, click here for injection training. It'll be helpful to review this part of the online video to see the medications and how to prepare them, mix them, and how to inject. Each of these medications is an injectable medication which has a corresponding manufacturer video which you are able to watch at any time. The videos will last anywhere from 3 to 4 minutes, and they're very helpful. They will also consist of in showing you injection technique as well. If I were to click on one of the medications, you will see the different steps outlined for you. There will be a narrator speaking to you about the different topics, and they will show you the different parts of the product and how to prepare it for administration and to inject and how to dispose properly of any sharps. And then off to the right, this is what the narrator will be speaking to you about. At any time, you can stop and pause the video and read the information to the right and then resume watching the video. This will be where you will need to go at any and all time that you have any questions about seeing the medication, what it looks like, how to mix, and how to inject. But do keep in mind that we are always going to also review this information with you when we call you during your cycle to help you know what your dosages are, and we will also assist you with where your medications are to be injected. To begin, we'll review an IVF cycle using injectable medications in combination with an egg retrieval and an embryo transfer. You will notice on your flow sheet that your nurse has given you, you will have a scheduling phase at the top of the flow sheet. There are several ways in which your physician can start your IVF cycle. She may prescribe birth control pills, estrogen patches, or a medication called Lupron. Each cycle protocol is based on your age, diagnosis, and gynecological history. Regardless of the steps in your individual protocol, all patients will start their stimulation medications for their IVF cycle on day 2 or day 3 or a day determined by their physician. On your cycle calendar, you will see that you will have a date row. You can apply this date under the column day 2 or day 3, depending upon when your nurse has you coming in to start your cycle. With these cycles, you will begin morning monitoring between cycle day 2 and 3 and up to approximately cycle day 13. You will not need to make any appointments. Your nurse will advise you of which office you can go to and the times, but we do require you doing vaginal ultrasounds and blood testing to determine your outcome and to determine your medication dosaging. Once you know whether you're starting your cycle on cycle day 2 or 3, you can apply your date on your flow sheet. You will notice that you will be coming in frequently for vaginal ultrasounds and hormonal blood testing. You will come in approximately 5 to 7 days or more, depending upon your response. Typically, most patients will come in between cycle day 2 and 3 up to approximately cycle day 13 on your stimulation phase of your flow sheet. You will also notice on your flow sheet that you'll have several medications listed for this type of cycle. You will need to take gonadotropins, which are stimulation medications that contain the hormones of FSH and LH. Some examples of these medications are Follistim, Gonal-F, Menopur, Brevel, and Repronex. These medications allow your body to develop multiple eggs so that upon your egg retrieval, we can take out multiple eggs. Typically, on average, most patients will develop anywhere between 6 to 10 eggs. In order to take you to an egg retrieval, we are hopeful that your body will produce at least a minimum of 4 eggs. Once you complete the gonadotropins and the anti-ovulation medications, you will be asked to stop those medications and in place of them, take one final injection. That injection will be a shot of HCG, which is human chorionic gonadotropin. During the stimulation phase, leading up to the HCG injection, the physician in the morning will ask you to speak with an early morning nurse. The nurse will review the proper administration and mixing technique of HCG, and she will review with you the pre-op instructions for an egg retrieval. This medication allows for the final maturation of the eggs and prepares the eggs for the egg retrieval. You will take this medication one time in your cycle, typically somewhere between cycle day 10 through 13. The injection site for this medication is in the buttocks. The nurses in the office can draw circles on the buttock area so that this will assist the person at home that might be giving you this injection. This is a one-time injection, and you will be given a specific time of when to inject. Once you take this medication, you will now be completing your stimulation phase and be moving on to the retrieval transfer. For patients who have a male partner, we will advise them during the stimulation phase that they need to prepare for collection day on day of egg retrieval. So we will have them take an antibiotic for 7 days, which we will prescribe and let you know when to take that medication. In addition, we will also review with the patient that her partner needs to have several days of abstinence prior to the egg retrieval in order to optimize the sperm sample. Typically, we're looking for 2 to 4 days of abstinence prior to the egg retrieval. For any patient with a male partner, we will be prescribing the antibiotics and working on the abstinence issues during the stimulation phase. Once the lady has completed her cycle with the HCG, she is now moving on to the egg retrieval and embryo transfer. The day after you take your HCG injection, you will notice on your flow sheet that you will be in the retrieval, transfer, and luteal phase part of the cycle. Luteal day 1 is the day after the HCG. We will do a final blood test and ultrasound during early morning monitoring hours to make certain that all follicles and eggs are present within the ovaries. The evening before the retrieval, which is luteal day 1, you will be asked to have nothing to eat or drink after midnight, since the retrieval is done under anesthesia. The morning of the retrieval, luteal day 2, you will be asked to have nothing to eat or drink. You can shower, shampoo your hair, but wear no perfumes, lotions, powders, sprays, or fragrances. Your partner will accompany you, and you will arrive at the 3rd floor of the Atkins Kent building in Livingston, across the street from the main hospital. All of our physicians within the practice maintain their proficiency in performing egg retrievals and embryo transfers. They all rotate through a rotation schedule, so you may see any one of our physicians during your egg retrieval. An egg retrieval is performed under general anesthesia using an ultrasound-guided needle aspiration. Each follicle will be drained and the follicular contents will be collected into a test tube. The test tube is then handed to the embryology team to analyze the follicular fluid to determine that an egg is present. This procedure can take anywhere from 20 minutes to 30 minutes. Once completed, you will be brought to the recovery room and it'll take approximately 1 hour to recover. If you develop any pain, nauseousness, vomiting, or fever once you leave our practice, you will be advised to call our office. Normal symptoms to expect post-operatively will be mild to moderate pelvic bloating and a little bit of mild to moderate cramping. It'll be recommended that you can take extra-strength Tylenol for the next 24 hours post-operatively. The evening of the retrieval, you will be asked to take 3 medications. First of your medications will be an oral antibiotic that you will take for 4 days, 1 tablet twice daily. You will also be asked to take a medication that is a type of steroid. This medication prepares your uterus for an embryo transfer. It makes certain that our bodies will not reject our embryos once they're placed into the uterus. A final medication that you will take in this part of the calendar is an intramuscular shot of the hormone progesterone. Progesterone will be administered into the buttocks, like you did the HCG injection. However, progesterone is for approximately 2 weeks up until the day of pregnancy test. It is not a timed shot. You will be able to select the time in the evening that works best for both you and the person administering the injection. Progesterone is a medication to help support the lining of the uterus, thickening the walls of the uterus, preparing the environment for an embryo transfer. While taking the progesterone, some of the common side effects you may notice are mild to moderate pelvic bloating, some cramping, breast tenderness, feeling tired, and slight constipation. If you should have any concerns about your symptoms, please feel free to contact your nurse. After the egg retrieval, patient will remain in the recovery area for 1 hour. Due to the anesthesia, patients will be unable to drive, therefore they will need a chaperone to drive them home post-procedure. The day after the egg retrieval, you will receive a call with fertilization results. This information will let you know how many eggs have fertilized once sperm cells have been placed with the egg. On the day of your embryo transfer, you will be asked to arrive 1 hour prior to your transfer. You will not need anesthesia, therefore you will not need someone to drive you home. However, it is encouraged to have both patient and partner present on the day of embryo transfer. There is a discussion that will take place with the physician to review your embryo quality and to review the number of embryos to be transferred. After the transfer has been performed, we recommend that you take the remainder of the day off to take it easy, but you may resume a normal schedule the following day. You will continue to take your progesterone injections, and you will come in several days later after the transfer to have a blood test done during the early morning monitoring hours. This blood test will check on your progesterone levels and determine that your body is absorbing the appropriate amounts of your injection of progesterone. We will call you with same-day results in the afternoon. 2 weeks after retrieval, you will be asked to come in for a blood pregnancy test. It will be just a blood test. We will confirm your outcome and call you with same-day results. If you are pregnant, you will continue to take your progesterone intramuscularly and return to the office within 48 hours. We will retest your blood work for the beta-HCG pregnancy hormone and then continue to test you with your pregnancy, doing once weekly blood testing and ultrasounds in the early morning, during the early morning monitoring hours. During this time, you will continue your progesterone, and we will wean you down off of the progesterone before you are discharged from the practice at 8 weeks with your positive pregnancy. If on the day of your pregnancy test, we call you and inform you that your pregnancy test was negative, we need you to stop all medications. You will typically get a period approximately 3 to 5 days after stopping the progesterone injection. You can call our office with day 1 of your period, but prior to even getting a day 1 of your period, we will arrange to have you schedule a follow-up with the administrative coordinator to speak to your physician to review the outcome of your cycle and any possible future IVF cycles. This orientation class is part of your checklist, Now that you have completed this orientation class, please email your nurse and IVF coordinator with the number that appears at the bottom of this screen. This will indicate that you have watched the video and can be noted on your checklist. The next step is to review with your nurse your cycle medications and view the appropriate medication instruction videos via the Freedom Med Teach link.